Good morning. My name is Kelly Cooper. I work in the medical field with a large physician medical practice. I recently helped put together a new pamphlet for the GI prep for Miralax split dosage, instructions for screening colonoscopies. Once I finished putting this prep instruction pamphlet together, I actually conducted some training with the staff. The medical assistants came into a classroom environment and we went over how to do a successful review of the prep instructions with their patients using some role playing. I'd like to demonstrate that for you now. Hi, Mrs. Smith. My name is Kelly Cooper, and Dr. Fred and I would like to go over your prep instructions for your upcoming colonoscopy. We're very happy that you've chosen to have the screening colonoscopy, as it's very important for anyone that's over the age of 50. In order, though, to get that best result from your screening colonoscopy, it's very important that you have a clean bowel. Any stool that remains in the bowel or the colon during the screening could hide small areas of growth, such as polyps, and could affect your results. Now, we don't want that to happen. So we're going to go over some very basic instructions, and we've got a pamphlet for you to take home as well. First, let's talk about when you can expect your results. Your doctor is going to talk to you right after you have your colonoscopy while you're still in the recovery room. You will also receive a phone call from our office about 24 or 48 hours just to check on you to see how you're doing. If you have any type of polyp that's sent in for a biopsy, we're going to call you with that result as soon as it comes in, and it takes about 48 to 72 hours for that. If there is anything serious at all, please know the physician's going to give you a call right away to talk to you. We're also going to send your results through our patient portal Healthy Link. And if you're not a Healthy Link user, I'm going to have the front desk sign you up on your way out today, because Healthy Link is a great way to communicate with your office for any questions, scheduling appointments, or receiving results like the results that you'll have once you complete your screening colonoscopy. So now let's talk about the day of your procedure. You need to bring a responsible adult with you. It's really important that this person arrive the day of your procedure with you, that they stay the entire time, and they're able to drive you home. Preferably, we'd also like them to stay with you after the procedure when you get home, give you a little something to eat, and just make sure that you're feeling okay. You also need to wear casual and very loose-fitting clothing. Leave all your valuables or any piercings at home, and arrive 1 hour before your scheduled procedure so you can sign your consent forms and get all ready so we can start you on time. Okay, now let's talk about the prep. There are a few things that you're going to need to buy for the prep, and I've got those here to demonstrate for you. First, you're going to need to purchase 2 of the Miralax 119-gram bottles. Now, you can always use one of the store brands or a generic brand to save you some money, but you're going to need to have 2 of these. You're also going to need to have some Ducalax tablets. You may have some of these already in your medicine cabinet at home, so be sure to check and ask any family members. They need to not be expired, and you're only going to need to take 4 of them, and that's detailed in your prep pamphlet as well. The smallest box, if you do have to buy them, you'll have to purchase is a box of 10. Lastly, you're going to need to get 2 bottles of Gatorade, 32 ounces, in order to have your prep mix. You may buy a bottle of 64 ounce if that's cheaper for you, but it's a little bit harder to make that mix. So we suggest, if you're able, please buy 2 of the 32 ounce bottles. That's going to make for the easiest prep for you. Also, one thing to remember, can't buy any red or purple Gatorade. That can possibly, the colors in that, the reds and the purple dyes, could possibly show something in your colon, and we don't want to be confused. So please make sure you avoid any red and any purple. All right, now let's review what's in your pamphlet that we're going to actually give you today. Let's talk about 5 days before your procedure. We want you to stop all of your medications. There are a few medications that are listed on the back here of your pamphlet that you would still continue on if you needed to, but right now, currently, you're not on any of those medications. So if anything changes and your doctor puts you on any of the medications listed on this pamphlet prior to your colonoscopy, you'll need to continue to take those, but I want you to stop everything else otherwise. Secondly, 2 days before your procedure, you're actually going to go on what we call a low residue diet beginning in the morning at breakfast. And basically what that means is anything that is white or light is going to be okay. We've got some things listed here for you, but no red meat, no fruits, no veggies, no seeds, no nuts. So things that are acceptable are eggs, soup, chicken, fish, white rice, plain yogurt, cheese, white bread, macaroni, noodles, ice cream, mashed potatoes. So think along those lines. And again, you can reference into the pamphlet. Starting at 6 that night, you're going to go on a clear liquid diet. Clear means being able to see through it. If you can't see through it, it doesn't count. So as we said before, Gatorade, that's our preferred drink. But you can also drink clear fruit juices, white grape juice, apple juice, water, Kool-Aid, of course, no red, no purples, popsicles, hard candies, sodas, etc. Now, at 6 o'clock also, we're going to want you to take 2 of your Ducalax tablets. You may notice that you have increased stools for the next 2 to 12 hours, and that's okay. That's what we're trying to accomplish. Now, the day before your procedure, you're going to continue on the liquid diet, but you're going to go ahead and do your first bottle of prep. So you are going to take 1 of your Miralax bottles and you're going to mix it with 1 of your Gatorade bottles. Now, the easiest way to do that is to take the bottle of Gatorade after you open it and pour out about 1 inch from the top. Go ahead and pour all of your Miralax into the Gatorade and shake it up really, really well and put it in the refrigerator, and it will start to settle and melt into the Gatorade. And by the time you're ready to actually drink this, it'll be just like it's Gatorade. You won't know any difference. It won't taste any differently. You'll be good to go. So at 6 o'clock that night, we're going to have you take 2 more of the Ducalax, and we're going to have you begin to drink your 32 ounces of Gatorade. You can do this at a rate of about 8 ounces every 15 to 30 minutes. About 2 hours, you should be able to get it down. If it takes you a little longer, that's okay. If you can do it sooner, certainly you can do that. If you feel nauseated, please stop drinking and give yourself about 30 minutes. Usually, most people get through this within the 2-hour time frame, but if it takes 3, again, that's okay as well. The morning of your procedure, want to make sure that 5 hours before you do the second bottle of prep. So you're actually going to do the exact same thing. You're going to have mixed it up. You're going to have shaken it. It's going to be cold in your refrigerator. And with this bottle, though, we'd like to get you to drink it within an hour period because we want to have you go NPO, which means nothing by mouth, about 4 hours prior to your procedure. So once you've finished drinking this, you are going to go off the liquid diet and you're going to have nothing by mouth for 4 hours prior to your procedure. Again, you're going to arrive about an hour before your procedure, and then we're going to be ready to go. Now let's review the location of your procedure. You're going to be coming to the Middle Ground Boulevard office. We're going to need you to come on the date that we've got you scheduled. It's all on your pamphlet. You need to make sure you bring your ID, your insurance card, and any copays that you need to take care of. We're going to give you an armband when you come in, and you'll wear that the entire time that you have your procedure that day. If you have any questions before the day of your procedure, feel free to call the office. We have a 24-hour nurse hotline as well, or you can refer to the pamphlet. It is all in here. Are there any questions now, Mrs. Smith, that I can answer for you? If not, again, your pamphlet has everything that you need in it. It's outlined everything that we've talked about, and I'm going to give this to you today, and we look forward to seeing you in a couple of weeks. Thanks. That's it. I hope that it was informative for you. For those of you watching that haven't had a colonoscopy, I hope this will sort of ease that fear and you'll realize it's really not as bad, the prep that you hear about. Any of you that have had, I'd love to know if this makes it simpler. I know that when I went with a colonoscopy for my mom years ago, it was very convoluted, and so now I feel like this is a much simpler thing for patients to be able to take home and understand. Enjoyed making this demonstration video for you. I hope you did as well. Thanks.